All right. Alrighty, it's 12:01, so we can go ahead and get started. Thank you everybody for joining us today. My name is Jasmine Michael. I'm a program manager with the Arizona Partnership for Immunization, or TAPI. We are all really happy that you are able to join us today for 10 things parents need to know about why we immunize, the training. We have two excellent presenters, Kai Mckinstry and Wendy O'Donnell, who are health educators with the Arizona Department of Health and Services. So we are happy they are here with us today. If you have any questions during the presentation today, please use the chat box. We would love to answer any questions you may have. And if we don't get to your questions today, we'll send a copy with all of the questions and answers via email after the training. All of the recorded training and the links for the resources will be available via email and on our website, and I'll put that link in the chat box as well. So thank you again for all joining us today for our training. We'll go ahead and get started with the presentation. Wendy and Kai, take it away.
Hi, I'm Kai Mckinstry. I am a Bachelor's of Public Health with a Certified Health Education Specialty. We are, oh, Wendy, go ahead and introduce yourself. Apologies.
Hi, I'm Wendy O'Donnell, and I have my master's in public health, and I have a master's certified health education specialist, kind of a mouthful. But yeah, so I am a parent, so immunizations hold a special place in my heart, and I've also been in public health education for my entire professional career. So this is very important to me, and I have a passion for this. So I'm glad to be here with you and share some of my experiences and some of my training.
Yeah, so as Wendy said, I'm also a parent. I have both, a formal education in public health as well as personal experience in public health, especially with immunizations for my little ones. So Wendy and I are super excited to be doing this because this really truly is something that is close to our hearts and that we feel super passionate about. And we're really excited that you are here as well, because it means that you have an interest in connecting with families and helping them understand why immunizations are super important for our little ones up through, our adult life. So thank you for joining us on 10 things parents need to know about why we immunize babies. We're going to go ahead and jump right in here. Maybe, there we go. So just a couple of reminders here. First things first, this is offered through Arizona Partnership for Immunization in partnership with CAHEC, Central Arizona Area for Health Education Center. So a huge thank you to CAHEC for helping put this on. This is a short little thing. I mean, it's really a lunch and learn, noon to 1:30. I am a fast talker, so I'm going to try to make sure I slow myself down a little bit. I just get so excited. But if for some reason I'm going too fast, put something in the chat, or I don't know, send a message to someone and let them know that you need me to slow down a little bit. As a kind reminder, we've all been living our virtual lives for about a year now, and some of us get a little more comfortable in our real life homes with our virtual lives going on around us. So please put your phone on mute, your microphone or your phone or whatever you're using. Put your device on mute. Also, statistically, a good chunk of us are not wearing pants, and the rest of us don't need to know that. So if you have a camera, make sure that is also turned off. Please use the Zoom meeting chat box to ask your questions. We've got a couple of people actually manning that chat box to try to make sure that those questions get answered. As Jasmine touched on earlier, though, if we don't get to your question, don't panic. We're going to try to address those questions in a mass email at the end of this. Please let the administrators know if you have any questions or technical difficulties. They'll try to help troubleshoot those things for you. And then again, like I said earlier, this is kind of like a quick thing, lunch and learn, try to get you as much info as possible in a short amount of time. So if you feel like you need to revisit something, or you need additional resources on something we've discussed, or you want to reference one of the videos we've shown you, you're going to get all of these resources and the handouts at the end of this training today. So we'll go ahead and get started here. And you'll see me kind of looking off to the side over here, and it's because I've got my notes on another computer over here, because I'm not extremely technologically savvy, but I know enough to do that. So if you see me glancing over here, I'm not distracted, but I am looking at my notes over here. So let's get started. This is a really interesting video. I want you to give it your full attention. It's something that's been put together to help kind of show us what we've learned in the past about immunizations and vaccinations. And honestly, it's an excellent resource for showing families if you are fortunate enough to be in contact with families right now. Wendy, can you confirm that you see this?
I want to tell you about a time in American history so that it never repeats itself.
So it never repeats itself. It was a harrowing time.
A heart-wrenching time. I could hear my mother warn me, Seal, don't go out and play.
My family was ravaged.
Thousands and thousands died.
I was scared.
So scared. And then one day.
And then one day, there was hope.
Before vaccines, there were few ways to help protect against deadly illnesses. Diseases like measles,
Meningitis,
diphtheria, Hib,
Whooping cough.
or polio, which killed my grandma's youngest son. Without vaccines, these threats can reemerge. I'm here.
I'm here.
I'm here to tell my children to help protect their children.
Get your kids vaccinated and keep them on schedule.
I never want my grandchildren to see what I saw.
And give me a second to close this out. Okay, so just a reminder, I suppose, if you will, that a lot of times we kind of get a bit disconnected from these diseases when it seems like, they're not around anymore. We've never known anybody with a lot of the diseases that we vaccinate against. And it's really just as simple as digging back maybe a generation to your grandparents or your great-grandparents who have absolutely had experiences with diseases that we vaccinate against. And now we have too. So there is a silver lining to COVID, and I certainly don't want to sound insensitive, but the silver lining to COVID is that we all have a public health experience now. And every single one of us can maybe someday be in a video like this that encourages future generations to stay on top of vaccinations. So something I just kind of want everybody to take to heart. So one of the 10 things that we want to cover in this training, our kids are at risk for a disease. I don't know if you remember the measles case in 2019. From January 1st to October 3rd in 2019, we had 1,250 individual cases of measles that spanned across 31 states. That is a relatively short amount of time for such contagious spread, if you will. This is the greatest number of cases reported in the US since 1992. And this is because we've been seeing such a significant decrease in vaccination rates. I'm going to check my notes over here, make sure I'm not missing anything that I want to make sure to share with you. It certainly, this incident certainly did wake us up and help us remember that, first of all, vaccination rates, meeting our vaccination rate of 95% really is important, but also that we need to make sure that we're pushing public health initiatives to encourage families to get their little ones vaccinated. A measles outbreak is something we absolutely do not need to have. A measles outbreak is something we absolutely can prevent as long as we're meeting those 95% immunization numbers. And we'll talk more about that 95% a little bit later down the road. Another prominent disease that we're facing right now as well is pertussis. It's another one where we're seeing an increase in spread and an increase in cases, and absolutely has a vaccine, that works. So we want to encourage people to get the vaccines for the diseases that are 100% preventable. Arizona kids are especially at risk because, unfortunately, a study was done that shows that Arizona has a pretty significant amount of exemptions, if you will, in our schools. So kids in the US are part of hotspots, which are the most vulnerable populations to vaccine preventable diseases. I have a note over here actually that, let's see, we had over 5 to 6 years, we had some schools reporting to ADHS that they had as little as 40% vaccine rates. I mean, this is a hotspot because essentially what that means is at least 60% of those kids are vulnerable to vaccine preventable diseases. And these aren't just diseases which will only affect those school kids. They will also affect the adults that they interact with. They'll affect other vulnerable populations like individuals who can't get vaccines for one reason or another, which we'll touch on later on. So this, again, is completely preventable, but is happening because we have such an increase in exemptions over the last several years. Ideally, we want to be at a 95% vaccine rate or vaccination rate in order to kind of create a herd immunity bubble, so that basically so that the rest of our community is not as susceptible or vulnerable to vaccine preventable diseases. Vaccine preventable diseases still exist. This is not something we don't already know, but it is something we need to touch on. The vaccine preventable diseases like measles, mumps, pertussis, which is whooping cough, and pneumonia still infect and cause sickness in children in the USA each year at a fairly high rate. And so now I'm going to torture you a little, and I'm really sorry. This video here on the left is, well, it's tough, but I do need you to watch it. And we need to watch it because sometimes we get a little tired. Sometimes we feel, again, like the chances of one of these vaccine preventable diseases affecting us is low, or I've never known anybody with it, so the chances of me knowing somebody with it are very low, or, you know, they're not that bad. So we're going to watch this little video of our little lady here on the left. Again, try to stick it out, try to watch it. It's not super long, but when we come back, I'll be crying.
They're just kind of heavy.
This little lady has whooping cough.
There we go. Okay. It's okay. Okay, take a breath in, honey. Come on. Almost there. There we go. Oh my. It's okay. It's okay. Yeah. It's okay. Here. It's okay. Yeah. That's okay, sweetie. Yeah. That's okay. Right. It's okay. Yeah. It's okay. Yeah. I know. Yes. Oh, I know. It's okay.
Okay, I'm really sorry to do that to you. Like, if you can see the tears in my eyes, they're genuine. I have such a hard time with that video, but the reason we need to show it is because we need to make sure that we don't fall into the trap of thinking these things don't exist. This video is in color. This is not something from, 50 years ago. This is a very recent video, and it's absolutely heartbreaking. And if there's nothing else you can do to help encourage your family to understand that these disorders, these diseases that are 100% vaccine preventable do exist, this is the video that you can use to show them that this isn't a situation you want to be in, and you certainly don't want your little ones in this position either. So, definitely let's remember that these diseases exist, and they are prominent in our communities. Okay, moving on from that. Number 3, outbreaks are preventable when parents make the decision to vaccinate. And so, I mean, I realize that we're all here because we want to make sure we have a firm understanding of how vaccinations work. We want to have a firm understanding of how to encourage families to follow through with vaccine recommendations. And we want to kind of troubleshoot some of the questions and issues we're running into when families have questions or concerns. The first thing I want to talk about, though, is herd immunity or community immunity. And I know that we've actually been hearing a lot about this with COVID. So again, a lot of this that we've been hearing with COVID is also 100% applicable to what we're talking about today. When we immunize 95% of the population against a vaccine preventable disease, then we can prevent an outbreak from happening. We obviously didn't have this opportunity with COVID, but we do have this opportunity with all of our existing knowledge on vaccine preventable diseases. So we need a community effort to protect our children, and you'll see it referred to as community immunity or herd immunity. Let's see. Just want to check my notes. Thank you for your patience. Okay. So we know that vaccines work. Vaccines are studied. Vaccines are followed to see how well they're working, and they are tested and updated as needed to work even better. If you look at the little graphic on the left here, this gives you a pretty extensive list of all of the vaccine preventable diseases that we have existing vaccines for, one of which was smallpox, which was eradicated in 1980 because we were able to decrease the incidence of smallpox to 0. So we decreased it 100%, which is phenomenal. Diphtheria, the last outbreak was in the 1970s. We have that decreased by 99.9%, which is, again, phenomenal. Pertussis, which is whooping cough, 94.9%. Tetanus has seen a significant decrease. Neonatal tetanus, we don't see anymore. Polio, we don't see anymore for the most part. We have eliminated it as of 1979. Measles, we had an endemic spread in the US, but it was eliminated in 2000. We had it decreased by 99.9%, mumps 98.9%, rubella. But then once we start getting to kind of one of the more recent, like perinatal Hep B, we've only seen, 94.1 is significant. That's excellent, but we'd love for that to be higher, right? Varicella, chickenpox, we've seen a decrease in 99.9% of chickenpox. Because of the vaccine and smart parenting. Wendy is going to discuss the chickenpox parties and the other parties that folks think is a good idea sometimes. But overall, we have seen a significant decrease in these preventable diseases. Vaccines save an estimated 42,000 lives every year in the US alone, which is amazing. That is significant. That's actually 3 times more than seatbelts and child restraints combined. And I honestly could not imagine putting any of my kids in a car without a seatbelt, as I feel most, if not all of our attendees would agree. So the fact that vaccines work and they're studied to work is extremely important and something that we want to make sure that our families are aware of. One of the things I wanted to touch on with the herd immunity that I had forgotten to mention was if you're looking for kind of an analogy to describe, and actually we can touch on it here. If you're looking for an analogy to kind of describe what public health and vaccinations kind of looks like, if you're a nerd like me, you can think of it as kind of like a force field around your most vulnerable population. And if you're not a nerd, you can think of it as like a fence around your most vulnerable population. And the idea here, especially if you think about it with COVID and how we can't vaccinate our kids right now, but we can vaccinate ourselves, us adult population, which again, we'll talk about a little bit later. You can kind of think of it as, if I'm vaccinated, my spouse is vaccinated, their grandparents are vaccinated on both sides. I've got 3 parents, I've got 3 in-laws. That is a really solid barrier of vaccinated individuals around my 5 kids. Now, my 5 kids can't get immunized. None of them are old enough for it. The trials aren't ready for that. But because we're taking precautions and we're vaccinated, what we're effectively doing is blocking COVID in this case from getting through to our little ones who aren't ready for that vaccine yet. And the concept is exactly the same when we're talking about any of these other disease preventable vaccines. And not just for kids, we're also talking about vulnerable populations like what is mentioned in number 5. Newborns receive some immunity from their mothers, but it wears off while they're still very young. So we do need to protect those little ones who just aren't of age yet to get specific vaccines. Some people can't get vaccinated because they're either too sick, so they're immunocompromised, or they have allergies. So vaccinating you and your family helps protect them, not just because they're little. They could be 18 or 25 or 64, but if they can't get the vaccine, who else is going to protect them but the people who can stop a disease before it gets to them? And we can do that with vaccines. Getting shots offers protection that will help your child's immune system fight when they're exposed to diseases. And this is kind of what I feel is kind of a common misconception about what a vaccine is. But what a vaccine does is essentially ramp up the immune system to start creating antibodies and recognize that once they get exposed to an actual disease, if you will, the body already recognizes it and is ready to ramp up those antibodies from the recipe that they've already received through the vaccine. I'm going to hand it over to Miss Wendy, who's going to cover numbers 6 through 10. Wendy.
Yep. So this slide goes really well after Kai's last explanation. Vaccine antibodies act as personal ninjas to protect from the actual disease. So this is how you can think of the vaccines in your body. After someone does get an actual disease, it can take several months to years for their immune system to fully recover, leaving them vulnerable to other illnesses and diseases. So it's better to get the vaccine and set your immune system up to protect yourself without actually having to get sick and compromising your immune system and leaving you vulnerable to other diseases. The vaccines create memory, so when the body is exposed in the future, the memory of the vaccine prevents actual infection and actual disease. And we've kind of touched on as well that there are several vaccines that are recommended for pregnant women to get to help strengthen the immune system of the babies when they are born. So babies get their first vaccine from their moms. Pertussis is the Pertussis vaccine, Tdap, is recommended for every pregnancy, and it can reduce infants' risk of pertussis by 91%, particularly in the first 2 months of life before those babies are old enough to get any vaccines themselves. So that video that we heard earlier, that poor baby with pertussis, this is one thing that you can do to help prevent something like that happening. And of course, just as important as it is for the mom to get it, it's important to keep that baby protected. So if dad and grandparents are going to be around baby, it's not a bad idea to get them vaccinated as well. And same goes with the flu. You know, we need the flu shot every year. And when moms get the flu vaccine during pregnancy, they reduce infant risk of flu by 70%. So that's a huge, huge benefit to the baby. So they're not only protecting the moms from getting really sick and having complications with the pregnancy, but they're also protecting the babies right after birth. And we know that the best defense against the flu is the flu shot. Hand washing, of course, is vital. It's super important, but the best defense is going to be the flu shot. It's been studied every year. It's recommended every year. It's a little bit different to try to match the strain that's circulating, but it's super important that pregnant women get the flu shot. And what's ultimately super important as well is that doctors and science support vaccination. So you can see all of this list of very reputable professional organizations are all in support of vaccination. So it's, you know, you trust your doctors with a lot. You trust them with making sure that you are at optimal health and giving you guidance to make sure that you are feeling your best. And you can trust them to give you the right recommendations for whatever vaccines are out there. Their education and knowledge and experience is what you can rely on if you have questions. So of course, if you get a tough question, that you don't feel completely confident in answering, the easy answer is talk to your provider or talk to your child's provider, because they are trusted members of your care team, and they can really help guide parents to make the right decisions. And then we know that, of course, in the first couple of years of life, babies are getting a lot of shots. It seems like almost every visit you go to in those first 2 years, you're getting some vaccine or another. But it's important to remember that when they go off to school, when they're doing childcare, preschool, it's important that they're getting their immunizations as well. They're in close contact with other children when they're in these settings, and you definitely don't want to risk getting sick and bringing those diseases home to, pregnant mom or immunocompromised mom, grandparents, other kids. You just want to make sure that you're sending them protected, and then they're coming home protected. This is something that is super important now that schools are opening back up. You want to make sure that you're encouraging your families to make sure that their children are up to date. And we know that there has been kind of a lag in childhood immunizations since COVID had started, which, you can't blame families for being nervous about taking their kids to the doctor. I would encourage you to suggest asking their providers about what their practices are. I know my children's pediatrician sees child visits. They do those all in the morning, and then they see the sick kids in the afternoon. So there's some buffer, and of course they're seeing fewer patients, and they're spread out a little bit longer. So they have a whole.
Wendy, we lost your audio. While you're working on that, though, I think one of the things I wanted to mention too was with COVID precautions right now, my pediatrician, thank God, is doing well child checks in office. So we are getting their vaccines in office. But a lot of the pediatric sites are doing drive-through vaccines, not just for COVID, but for our well child checks too. So I'm not necessarily suggesting that you encourage families to change pediatric practices, because I don't think that's in their best interest at this time. But do encourage them to find out what their practices, policies and plans are. It's been a year, so lots of them have come up with some pretty creative ways to make sure kiddos are getting their vaccinations. Wendy, do we have you back yet? I'm going to shoot her a note to make sure she knows we can't hear her, because sometimes.
Can you hear me now?
Yeah. Welcome back. I did everything for you. I'm just kidding. Go ahead.
You can't hear me?
We can hear you.
You can hear me?
Yep.
Okay. For some reason, I can't hear you, but I'll just keep going.
I don't know. Go ahead.
I'm sorry about that. I have a computer with a mind of its own. What I was saying is that the risk to me of having my children not immunized and sending them to school is scarier than making sure that they're safely seen by their provider and get the immunizations that they need.
Especially because COVID isn't as tough on kiddos, but measles and varicella and pertussis and pneumonia, those are really rough on little ones, especially. So I realize that there's a lot of exposure risks to COVID, but the exposures to these other vaccine preventable diseases is also, I mean, it is very real, and it can be very scary. Are you there, Wendy?
Oh, yes. Okay. Sorry about that. I'm back and I can hear you.
Okay, perfect.
Oh, sorry. And then also, like I had mentioned, of course, most of the shots that your child gets are in those first couple years of life, but you want to make sure that they're getting them at the right age range. So this is again where it's really great to have a good relationship with the provider because they will let you know when your child is due for a shot. And it's not just kids; it's up through middle school, high school, college, and so this says and college, but then it's also through adulthood. We know that like I had mentioned, with each pregnancy, the flu shot is recommended, Tdap is recommended. So you want to make sure that you're staying up to date with those. Not only making sure your families do and recommending that they talk to their providers, but you yourself, who is going to be working with people closely, you want to make sure that you're getting what's recommended for you as well.
Okay, we're going to watch this quick video about understanding why vaccines work. It's interesting. So turn your volume up and enjoy this. After this brief and
January 2017.
I like how she said 17.
Aren't you glad you don't have scurvy? In 1747, in the first medical trial ever performed, Scottish physician James Lind found out that eating citrus fruits could cure scurvy. Now, today we know this works because citrus contains high levels of vitamin C. In fact, ascorbic acid, a common name for vitamin C, comes from the Latin for not scurvy. By issuing rations of lemon juice to sailors, the British Navy was able to pretty much eliminate the disease until the late 1800s, when polar explorers suddenly began to see scurvy again. The copper pots holding their lime juice had destroyed the vitamin C, but they were pretty confused. So despite James Lind's experiments 150 years before, citrus fruits became the enemy. And when Robert Falcon Scott set out to reach the South Pole in 1911, he carried the finest in canned meat products, biscuits, chocolate, tea, and zero vitamin C. A Norwegian team beat them to the pole by 5 weeks, and during their sad journey home, Scott and his team perished in a blizzard, sick and weak from what was probably scurvy. It had been so long since anyone had seen this disease, the British had forgotten how to prevent it. When we create such effective solutions, we can forget how serious the problems were. Thankfully, people today don't die of scurvy or polio. Since the introduction of Jonas Salk's polio vaccine in 1955, the disease has been nearly eradicated from the earth.
The thing to remember is that this is a continuous process.
Compare the 358 infections reported in 2014 to the 1940s, when 500,000 people per year were paralyzed or died from polio infections. Vaccines work. Our immune system is on constant alert against germy baddies, with millions of white blood cells each on the lookout for specific infections. When an immune cell meets its target, it replicates itself, and this clone army sends a barrage of protein weapons called antibodies to label the trash for cleanup. And after the infection is gone, so-called memory cells stick around, ready to mount a fast attack in case this germ shows up again. This is how we develop immunity, and it works pretty well, since we're all still alive. But even with all that, some super bad germs can take us out before our immune sentries have had time to call up their clone army. This is especially true for young children. Their immune systems are fresh out of basic training. Thankfully, we have vaccines, which are made of tiny pieces or weakened versions of viruses or bacteria. They let our immune system see what the bad guys look like and recruit those all-important memory cells before we ever have to actually see the real enemy. Thanks to vaccines, the US was able to eliminate measles in the year 2000. But in recent years, as more and more parents are refusing to vaccinate their children or are vaccinating them later than what doctors recommend, it's back. In most states, more than 90% of children are vaccinated, but that's not enough to keep a disease like measles at bay. In our episode about Ebola, we talked about a number called R0, the basic reproduction number for a disease, or the number of people infected by one person in a susceptible population. For Ebola, that number is low, but for measles, each sick person will infect up to 18 others. Luckily, vaccines can change that. The fraction of people who are vaccinated or immune can lower the reproduction number below 1, which means the disease is disappearing. 90% of unprotected people who come in contact with somebody who has measles, even just breathing the same air, will become infected. To control a super contagious virus like that, the vaccination rate has to be 95% or above. And right now the US is lagging behind, and measles is making a comeback. The Guardian put together a simulation of just how this so-called herd immunity works. When enough of a population is vaccinated, even if it's not 100%, the herd can protect the unprotected. With vaccine refusal on the rise, our herd immunity is breaking down. Preventable diseases like measles and whooping cough have become our scurvy. Most of us don't know anyone with polio, and I mean, measles. It's not that bad, right? Well, yes, it is that bad. Before the age of vaccines, millions of people were killed by diseases that today are just bad memories. Vaccines have let us develop a sort of generational amnesia. Today we expect our children to grow up healthy, and we're lucky that we don't appreciate just how dangerous these diseases are. Like science writer Seth Mnookin says, vaccines are victims of their own success. Because of stories like Andrew Wakefield's discredited study wrongly linking vaccines and autism, and the news media's obsession with pictures of crying, terrified children being poked with needles, people are nervous about vaccines. This anxiety isn't new, though. When Edward Jenner in 1798 saw that milkmaids didn't catch smallpox, well, he realized that because they'd been exposed to the similar cowpox disease, they were immune. And based on this, he developed an early smallpox vaccine by inoculating humans with the cow virus. In fact, the word vaccine itself has bovine origins. Still, as far back as 1802, critics were claiming that the smallpox inoculation would turn you into a cow. Vaccines don't come without risk. Nothing does. But on average, fewer than 1 in a million people will experience a dangerous reaction to common vaccines. Car accidents, playing outside, even walking will injure more children. Vaccines are asking us to do something altruistic, to make a choice to protect not only ourselves and our children, but also those around us. Author Eula Biss says that vaccines are one of the most empathetic things that we can do. A system that's based on people voluntarily using their bodies to protect other vulnerable people. That's something I hope we don't forget. Now, I'm a doctor, but I'm not that kind of doctor. It's natural to have questions about vaccines, and you should have a conversation with your medical professional. They want the best for you and yours. I will give you one prescription though, and that's to subscribe so you can get a full dose of science every week. And if you want to read some amazing books about vaccines, check out Seth Mnookin's The Panic Virus and On Immunity by Eula Biss. Links in the description. Stay curious. Today we know...
All right. Okay, so I just think that was a really fun video because it really kind of tackles the beginning questions that people have about why we vaccinate, what's the point in vaccination, how much history is there behind vaccines, how do they work, how do we know they work, why are they important? I mean, all of these are really kind of general questions that a lot of parents and other caregivers have. And so this particular resource, which you are going to get at the end of the training, is super useful, and you should show it to folks. When I actually was first asked to be a panelist for this many months ago, and I was looking at this video, I started sharing it with some of my friends and family because I had not seen this one yet. And it's really very useful actually for this COVID conversation we're having right now. My own mother, as sad as I am to admit this, was like, I'm not going to get that COVID vaccine because they didn't do any research on it and they streamlined it and they did it so fast. And so finally, we had this conversation, of course, and the one that I'm having with you now. But I also sent her this video just really quick. And I mean, she was so grateful because it's excellent, and it speaks to her in a way that gets to the point and answers some of those most basic questions. It's not demeaning. It doesn't feel like propaganda. This is excellent work. So please pull this and use it for your families. If ever you have an opportunity to throw it up on a screen while your family is waiting, or you're able to throw it up on the tablet that maybe one of the kids has from whatever your resources may be. If you've got an opportunity to show this video to your families and other primary caregivers, please do so. Okay, so we would like to know what some of the hard to answer questions are that you're hearing. We're going to cover some of the most basic ones that we've been running into, but grab your device, your smartphone, your computer, whatever you're listening on, get into that chat box and start typing in some of those questions. We may not get to all of them, or you may have the same question as someone else. So, review it and see if someone else has already asked this question. But we would like to try to tackle some of those. In the meantime, let's talk about the journey of a vaccine. This is particularly important right now. So here's the scenario. A couple of your friends, reading is so hard. A couple you are friends with tell you that they worry newer vaccines are not safe. They worry that the pharmaceutical companies make vaccines without testing them before they're given to kids and adults. What resources do you have available to them to help with their concerns? So, obviously, this is pertinent right now because of the COVID vaccine. We've got a lot of concerns that the COVID vaccine was streamlined. It was pushed through all the red tape. There wasn't any or enough research done. There haven't been enough trials. There haven't been enough cases, et cetera. And we are definitely going to tackle that concern. There's this really cool graphic here on the left, the journey of your child's vaccine. You can definitely use that graphic. Immunize.org, this little hyperlink down here at the bottom is it's another kind of PowerPoint that addresses a lot of the same hot button topics. But we're going to watch a video after this that kind of talks a little bit more about this. What I do want to touch on really quick is the hot spots. Hasn't it been proven that there are dangerous hot lots of vaccines? And this kind of goes into vaccine efficacy and safety. The FDA very carefully regulates the production of vaccines. So this concept of hot lots is that there's more reactions occurring from a specific lot of vaccines. And this concept is based on the presumption that the reports to VAERS means that a vaccine lot is more dangerous. This is actually not the case. Reports to VAERS prove nothing about causality. And part of the reason this is important is, and this is really only if you've heard concerns about hot lots, but a lot of vaccine can be a couple 100,000 to a couple million vaccines in a lot. So this lot of 100,000 vaccines may have 6 adverse reactions. This lot of 3 million might have 100. Now they're saying the one that had 100 adverse reactions is a hot lot, even though there was 3 million vaccines in there. So the hot lots concept kind of needs to be done away with. And one of the best ways to kind of eliminate the concern around that is just to make sure people know that lots vary in size dramatically. So this really isn't a proof of causality. Okay, let's watch this video here. Sorry if you hear my dog.
The journey of your child's vaccine. A vaccine must be safe and effective. How a new vaccine is developed, approved, and manufactured. Vaccines begin the journey in the laboratory, where scientists work to figure out how best to protect against dangerous germs. Before a new vaccine is made available to the public, researchers usually must do years of lab tests on the vaccine. If lab results look promising and the vaccine appears to be both safe and effective, volunteers will be enrolled to get the vaccines in a series of carefully monitored clinical trials. The manufacturer usually conducts 3 phases of clinical trials. Each phase is designed to gather more information about the vaccine's safety and how well it works. These trials can take years to complete. During phase 1, about 20 to 100 healthy adults get the vaccine. Researchers track how well the vaccine works, whether it's safe, what is the correct dose for disease protection, and what possible serious side effects may occur. In phase 2, hundreds of volunteers participate. This is when experts learn more about the possible short-term side effects and how the volunteers' immune systems are responding. Phase 3 trials are the most informative, with results from hundreds or even thousands of volunteers. In these trials, vaccinated volunteers are compared with volunteers who receive another vaccine or no vaccine. These results give researchers a better idea of how well the vaccine works and if there are possible side effects they should expect. The Food and Drug Administration, or FDA, along with the Vaccines and Related Biological Products Advisory Committee, review all of the data the researchers have gathered throughout the trials and decide whether or not to license the vaccine. Once licensed, vaccines are made in batches called lots. Manufacturers test the lots to make sure the vaccines are safe, pure, and potent. The FDA reviews the safety and quality of each lot before it is released. The FDA inspects manufacturing facilities on a regular basis to ensure quality and safety. How a vaccine is added to the U.S. Recommended Immunization Schedule. Once the FDA licenses a vaccine, CDC brings together the members of the Advisory Committee on Immunization Practices, or ACIP, to review all of the research available on the licensed vaccine. The members of the ACIP include world-renowned vaccine and disease experts from groups like the American Academy of Pediatrics and the American Academy of Family Physicians, CDC, and other government agencies. These experts look at how well the vaccine works and whether it's safe when given to different age groups. They also weigh the seriousness of the disease the vaccine prevents and figure out how many children would get sick if they did not get vaccinated. The experts then decide if they should recommend that vaccine be added to the U.S. Recommended Immunization Schedule. If the CDC approves the experts' recommendations, the vaccine officially becomes part of the schedule, and soon it will be available at your healthcare provider's office. How a vaccine's safety continues to be monitored. Once children start getting the vaccine, the FDA and CDC continue to watch for possible side effects. Reactions that happen after a vaccination get reported to the Vaccine Adverse Events Reporting System, or VAERS. Anyone can submit a report to VAERS, including parents, caregivers, patients, doctors, and nurses. However, the reactions that are reported may or may not be caused by the vaccines. They may require further investigation. Researchers at FDA and CDC analyze the VAERS reports and look for any trends that may be happening. FDA and CDC also use other vaccine safety systems. The Vaccine Safety Data Link, or VSD, and the Post-Licensure Rapid Immunization Safety Monitoring System, or PRISM, actively monitor new vaccines to obtain additional information about their safety. VSD has access to healthcare information for over 24 million people. PRISM can analyze healthcare information from over 190 million people. CDC also uses the Clinical Immunization Safety Assessment Project, or CISA, to study vaccine safety. CISA is a collaboration between CDC and 7 medical research centers. CISA vaccine safety experts conduct individual case reviews and clinical research studies about vaccine safety. Recommendations for using the vaccine may change if the vaccine's risks are found to be greater than its benefits. The end goal is always the same: to safely and effectively protect children, families, and communities against potentially serious diseases. For more information, please visit cdc.gov/vaccines or cdc.gov/vaccine-safety or fda.gov/CBER.
We'll pause that right there. If anybody needs to write any of those down, please do so. I'll give you just like a couple seconds, only because, I mean, all of these resources are available in the end, but if you need to write this down, that's totally fine, because I can't send you a live video, so just in case. This is, I really like that video. I realize that there's a lot of acronyms, and I realize that there's a lot of, you know, the PRISMs and the VAERS and all the other agencies and monitoring systems that we use. And if you memorized all that or knew it all already, kudos, good for you. That is awesome. If you don't know it, that's really, really okay too. The goal is not to kind of overwhelm you with this information, but rather to kind of give you a broader idea that there is more than just the CDC watching out for vaccine efficacy, side effects, safety concerns, etc. It's not just the FDA, it's not just the CDC. There are several organizations whose either primary or only goal is to ensure vaccine safety and vaccine efficacy. So when we have parents who have a lot of concerns around whether or not vaccines are safe for their little ones, I mean, just in the back of your mind, remember, it's not just one or two agencies that are on the lookout or watchdogs to make sure these things are safe. There are many agencies out there that are kind of acting as that gatekeeper for safety and efficacy of vaccines. Moving right along. And please remember to keep putting those questions in that chat box. I'm sorry if you're hearing my sweet puppy talk back right now. I was just explaining that we replaced the floors in our living room, and so now it's really clicky clacky and that's very distracting. So he's gonna hang out outside for a bit. Moving on, COVID-19 vaccines, the exciting stuff. We have a lot of questions around COVID-19 vaccines, and that is completely understandable. That's completely expected. And as responsible caregivers, parents, providers, we need to have questions. If you're not a person who's asking questions, then you're not doing your job right. So thank you for being here. Thank you for educating yourself. Thank you for coming with those questions and making sure that you have a firm understanding of what we're asking the community to do from a public health perspective. So about COVID-19 vaccines, the safety of COVID-19 vaccine is a top priority. Full safety trials were done on each vaccine and ongoing monitoring continues. That's the part I really want to highlight. Full safety trials were done on each vaccine. I absolutely realize that this feels extremely streamlined. I absolutely understand that this feels like we have a vaccine in less than a year, and that just seems suspicious. But the reality is, when we're testing vaccines, for example, the polio vaccine, we needed so many clinical cases in order to test the vaccine. It could take any number of months or years in order to have enough positive clinical cases that we could test a vaccine on, that quite frankly, it could take a decade to come out with information or a vaccine or some type of safety protocol. But with COVID, we actually had so many positive cases in such a short amount of time that it really didn't take much to find 100,000 people who were COVID positive and ready to do vaccine trials. I mean, this is a contagious disease that is really, I mean, it is extremely effective in its contagious. Contagiousness isn't the word I'm looking for, but for lack of a better word, it's extremely effective, and it gets around very fast. It didn't take long at all to get as many clinical or clinically positive individuals as it would have taken many or most other diseases that we've developed vaccines around. So again, there were no shortcuts. There were the appropriate amount of individuals who were positive and or not for our placebos. Please get out there, look at the research. I believe we have some links included, maybe in one of our resources. I'll double check for you, but just pay attention to the clinical trials, look at the numbers, look at the volume, and you will see that there were as many people as was absolutely necessary to do a full safety trial with our COVID-19 vaccines. The COVID-19 vaccines are not recommended for children at this time. It's not because they're not safe. It's because kids were not included in the clinical trials. That's not how we typically do safety trials for vaccines. We don't typically include kids. So now that the vaccine has proven safe for adults, and so far there have been no significant concerns for adult vaccines, a lot of pharmaceutical companies have started adding children to their existing trials. So there are kids now included in a lot of these trials for COVID-19 vaccines. And hopefully, as long as all goes well, the kids will be able to start getting vaccinated in the fall. So that's really exciting. That's really good news.
Okay. I just wanted to mention one thing as well. Typically, when a vaccine is developed, it's one company working on it in a lab. It's a few scientists as money is available. The environment that the COVID-19 vaccine was created in was incredibly collaborative.
Oh, yeah.
People were working around the world. Scientists were working together. They were sharing information. It wasn't a competition. So that definitely aided in the ability to develop this vaccine as quickly as it was. So it doesn't mean that any safety, that there are any corners cut for safety, just meant that we were working together. We recognized that this was a huge problem and that it needed a solution as quickly as possible. So I just wanted to mention that.
Yeah, that's a solid point. Actually, thank you for bringing that up. I think that's extremely important. furthermore, I mean, one of the other things I wanted to mention, and we'll go back really quick, with the COVID-19 vaccine was the potential side effects. I had told Wendy that I was planning on, sharing that I had received both vaccines. And I also had some side effects, nausea, headache, low-grade fever. So the side effects are real, but that has nothing to do with any kind of like full safety trial or cutting corners or anything like that, which is something else that I had heard and I wanted to make sure that I addressed. Side effects to a vaccine do not mean that any kind of corners were cut or that there's any kind of safety concern. Typically, a side effect to a vaccine, like a low-grade fever, a sore arm, in my case, some fatigue or a headache or a little nausea or whatever, is indicative that my immune system has actually ramped up production and is starting to work on producing antibodies. So I guess my goal is just to make sure people know that the side effects are not as a result of some kind of safety concern, rather that my immune system is working. Wendy, anything else you wanted to add before we move to the next slide?
I actually got my second vaccine on Monday, so I'm super excited. I'm also 29 weeks pregnant, so I worked with my OBGYN. I made sure that I followed the recommendations, but it's recommended that pregnant women get the COVID vaccine as well. So I actually didn't have any. I had a tiny bit of a sore arm after the second shot, so I'm one of the lucky ones that it didn't really knock me down or anything. But I was fully expecting it, and I still wanted to make sure that I was getting the vaccine because I know that those minor inconveniences is definitely going to be worth it to me and my family and my community. So that, I just wanted to share my experience too. I think we hear questions about pregnant women getting it. And again, it's hard to get pregnant women, kind of like kids, it's hard to get pregnant women in some of these trials for the vaccines, but because the American College of Gynecology is recommending it, my doctor's recommending it, the professional world is recommending it, I felt safe. And I'm very happy with my decision to do that.
That's awesome. And that's an important point too. I mean, I'm no hero, but I would actually much rather just deal with some minor symptoms than the possibility of giving my elderly in-laws, for example, COVID, or a total stranger, or somebody who's immunocompromised, or God forbid, any of my kids, or nieces and nephews, whatever. I mean, there's a community of people close to me, but also just generally here in my neighborhood that I love and I adore, and I would much rather have a little headache and take a nap than risk the lives of the people that I love. So anyway, I mean, again, I realized that we were very fortunate to be a couple of folks who were able to get our first and second vaccines. So I would encourage everybody else who is still striving to get their vaccines or still working to get families vaccinated, that you keep fighting the good fight. I mean, make sure you get online, make sure you help people get registered however possible, be diligent, don't give up, don't, encourage families to be diligent, get them registered, get them vaccinated.
I also want to mention, and this is something Kai and I were talking about this yesterday, that she didn't really think of when we were talking about it, but Kai and I were eligible because we work for the state health department and we are essential workers, as are all of you. And it's important that we stay healthy so we can continue to do our jobs to help protect babies in Arizona. And that is very similar to the position that you are in. We want to make sure that you're staying healthy and that this doesn't take you out for weeks at a time so that you can continue to serve your families, your communities, and Arizona as a whole. So of course you think about yourself and your family and the people you see immediately, but also think about it as like on a larger scale, that if you weren't doing your job, who would do that and who would help take care of those families? So I just want to mention that your job, you're very important. Of course, your families are important, but what you're offering, the service and your experience and your expertise is super valuable, and it needs to be protected as well.
That's such a solid point. Well put, Wendy. All right, so the next slide, it's your turn. It is your turn. Educators and childcare providers, it is your turn. There's a link on here, whyimmunize.org, find a COVID-19 vaccine. Again, this will be sent to you, but if you need to take a minute to write it down, please do so. Please get on, please register, learn about the vaccine, make your appointment. It is your turn. Again, please don't think we don't understand that there is a scramble to try to get an appointment. Absolutely, 100% we understand that. What I don't want you to do is lose hope. I don't want you to decide that it's not worth it. I don't want you to decide that, you know, whenever you get a chance, you'll get your chance. I want you to fight for your vaccine. You earned it, you deserve it. You're an educator, you're a child care provider, you're a primary caregiver. I mean, whatever the case may be, you're here because you deserve it and it's your turn. So please get on, please get yourself an appointment. Please get yourself vaccinated. Okay, moving right along. Immunization conversations. All right, so this is a scenario about a family who's concerned that there may be too many initial vaccines for their little one. Mom and dad both think vaccines are good, but that babies get too many at one visit and their immune systems are still too new for so many. They plan to delay some vaccines and only get 2 at each visit. What are some things you can say to educate them and reassure them? So, again, here's some excellent graphics and some excellent resources, and I'd like to give you an opportunity to just kind of look through these on your own. We are going to watch a short little video though, so that you can have a little bit more context. Just from a personal point though, I admittedly was one of those people. When my first little one came to me, I had a hard time watching him get vaccinated. I had a difficult time with the list that they gave me because he was behind on vaccines when he came to me, and it was like, my head exploded. And this is with a degree and public health education experience. So I can't imagine what some of these families might be feeling without already knowing how necessary this is. So this video with Dr. Offit is excellent. It describes a lot of it describes in detail kind of what you can say to some of these families. And thank God my pediatrician kind of talked me off the edge and was like, hey, you know what? This kid is awesome. This kid's immune system does great things. And this is one of the things that you can say to your families is, listen, this kiddo's immune system is brand new. Literally everything they come in contact with in the world is new. There's not a lot of difference between peanut butter on your hand and a vaccine. There is, but you understand generally what I'm trying to say. So everything that this little kiddo is coming across, be it by vaccine or through natural exposures, is causing an immune system ramp up. And they can tackle thousands of those at a time. So there's just not too many vaccines. But I understand where the anxiety comes from. Let's watch this video.
Hi, my name is Paul Offit. I'm talking to you today from the Vaccinate Education Center here at the Children's Hospital of Philadelphia. The most common question that we get asked here at the center is, do babies get too many vaccines? It's an understandable question. In the first few years of life, babies get vaccines to prevent 14 different infections. That can mean as many as 27 inoculations during that first few years of life. It can mean as many as 6 shots at one time. And I don't care how smart you are about viruses or immunology, it's hard to watch your baby go through that. So the question is it too many? Well, so let's take a step back. When babies are in the womb, they're in a sterile environment. When they enter the birth canal and the world, they're not. And very quickly, they have living on the surface of their body trillions of bacteria. I'm not just trying to sound like Carl Sagan here, literally trillions of bacteria. You actually have roughly 100 trillion bacteria on the surface of your body. That's more than you have cells in your body. Now, each single bacterium has between 2,000 and 6,000 immunological components. Now, by immunological component, what I mean is the complex sugar that sits on the outside of the bacteria, so-called polysaccharide, or the proteins that make up the bacteria. Viruses also have proteins, and those are considered also immunological components. Now, if you add up all the immunological components that are currently contained in vaccines, it adds up to about 160. So think about that, 160 immunological components which consist of viral proteins, bacterial proteins, or bacterial polysaccharides, as compared to the trillions of bacteria, each bacterium of which contains 2,000 to 6,000 immunological components. So I think literally what you are exposed to in vaccines is a drop in the ocean compared to what you're exposed to in daily life. Frankly, I think a cut on your knee is a greater challenge to your immune system than are vaccines. I think the common cold, which can reproduce itself thousands of times in your body, is a greater challenge to your immune system than vaccines. So I think the short answer to the question, can babies tolerate so many vaccines given in the first few years of life, is yes. Because frankly, they encounter far more in their environment than they're ever going to encounter in vaccines. Thank you.
And no, Dr. Offit's not my child's pediatrician, but she's as smart as my child's pediatrician. So Dr. Offit, if again, write his name down or save his name in your memory bank, or make sure to revisit this in the resources once you get them at the end of this. Dr. Offit is really a very valuable resource when you've got questions about certain things, or you want to give families maybe short snippets of things to watch or to provide education with, or even, you know, if you're training or educating your own staff. There's several Dr. Offit videos. I hope we have time to get through most of them, but it's certainly something that I would suggest keeping in the back of your mind. Okay. Ingredients. Mom says she's heard that there are really dangerous chemicals in vaccines, like formaldehyde and mercury, and is not really sure she wants to vaccinate her child. Again, we're going to provide you with some resources here. Okay. And again, this is the text information. I find the videos to be far more informative just because that's the kind of learner that I am. I'm going to move forward to the videos here, but one of the big ones I wanted to touch on was aluminum. Aluminum is used in some vaccines as an adjuvant. So it's an ingredient that improves the immune response. Essentially, the aluminum goes in and the body goes, well, hold on, that's not supposed to be there, and it responds faster. Adjuvants can allow for use of less antigen, and they also have been used for purposes, they've been around for a long time, more than 70 years. It's the most common metal found in nature. It's in the air, it's in the food we drink. Infants actually have aluminum in their breast milk as well as in formula. So aluminum is one of the big ones that gets touched on. So is mercury, and that will be discussed in the video. But most of the aluminum in the body is quickly eliminated. It's not something that our bodies don't already know how to deal with. Oh no, here we go. Well, this video wants to give me a hard time. Thimerosal, that's what we're gonna watch here.
Hi, my name's Paul Offit. I'm talking to you today from the Vaccine Education Center here at the Children's Hospital of Philadelphia. I think one of the concerns parents have is about a potential additive to vaccines, the preservative mercury. Is mercury in vaccines? And the answer to that question is that mercury is in some multi-dose preparations of the influenza vaccine. The form of mercury is called ethyl mercury, and the name of that product is called thimerosal. Now, one could reasonably be concerned about this, knowing that mercury, certainly at high concentrations, can be toxic to the brain and so-called the central nervous system. But in order to understand, I think, why it is that the mercury that was contained or is contained in some multi-dose preparations of the flu vaccine isn't harmful, I think we need to step back and try and understand mercury in our environment. Mercury is in the Earth's crust. It has been ever since the formation of the Earth. It's in an inorganic form through things like volcanoes and rock erosions. That inorganic mercury comes to the surface of the Earth, where it in soil or on the surface of the seas, it is taken up by bacteria and methylated. So it goes from inorganic mercury to methyl mercury. That methyl mercury is now organic mercury. It has the capacity to cross cell membranes and do harm. Now, the quantity of methyl mercury that's in the environment is actually far greater than one would ever be exposed to in the mercury that's in vaccines, which actually isn't methyl mercury. It's ethyl mercury, and it's a larger molecule, and as a consequence, is excreted from the body 10 times more quickly than is methyl mercury. So whereas methyl mercury accumulates to a far greater extent in the body than ethyl mercury, I think parents should be reassured by that. But I think more reassuring is the fact that just to know that because we all are exposed to methylmercury all the time, and it's in anything that's made from water, including breast milk and including infant formula, that babies are exposed to far more methylmercury in what they drink as young infants, either in formula or in breast milk, than they would ever get from the mercury in vaccines. And remember, the vaccines or influenza vaccine isn't given to less than 6-month-old children. So again, there's no avoiding mercury, and as is true, there's no avoiding many heavy metals in the environment. We all have cadmium, thallium, beryllium, even arsenic in our body, but it's at quantities far below that would ever do harm. Hope that helps. Thank you.
Okay, so with this video, I recognize that it was certainly a little wordy. Frankly, this particular video, I wouldn't necessarily recommend using as a resource to families, just because it gets pretty technical when he talks about the ethyl and methyl mercuries. But the general takeaway is, first of all, again, just like aluminum, we're already exposed to heavy metals in our environment. It's not inherently a bad thing. And the amount of mercury, ethyl mercury, that is in the vaccine is in no way dangerous. It's not a dangerous level of mercury exposure. Again, this video is not, I don't feel that it was super reassuring to a family, but as an educated provider, you yourself can I think, summarize that for folks and just say, hey, at the end of this, like, the amount of mercury that baby is being exposed to is far less from this vaccine than it is in the general world. Okay. Some additional information. Oh, bummer. There we go. Some additional information on ingredients. Fun facts to share about vaccine ingredients that are naturally occurring in our bodies, foods, and breast milk. And this obviously ties into the previous slide and information. So aluminum. In the first 6 months of life, infants receive more aluminum in their diet than they do from vaccines. And this is through breast milk or through formula. Formaldehyde. Formaldehyde really has a bad name for, I think, obvious reasons, but it actually is naturally occurring, and most of us are exposed to it every single day. There's more formaldehyde naturally circulating in an infant's body than is contained in their vaccines. And then thimerosal. There's more mercury in a can of white albacore tuna than contained in some flu vaccines. Again, we don't give flu vaccines to kids under the age of 6 months. We shouldn't be giving tuna to kids under the age of 6 months or a year either. So definitely something to keep in mind. Wendy, I'm going to hand it off to you.
All right, sounds good. Let's hope my computer cooperates this time. So unfortunately, this is still a question that we see a lot. A mom of a 13-month-old toddler is sharing in her mom's group that her baby is not the same as she was before her MMR shot. She's worried that the shot caused harm and wants to warn others about vaccines and autism. So this was just a misconception that has been shared widely and unfortunately is still circulating when there is absolutely no proof of the link. But there are some resources because it is a common misconception. You will hear it, and you want to make sure that you have the right tools. The next slide. So these are a few resources that are available out there. There's so many studies have been done to disprove the link between autism and vaccination. So these are some resources you can use. The next page has a video, and I think I will show this one even though we're a little short on time, but I think because this is a common one, I think it'll be good for you to hear.
Hi, my name is Paul Offit. I'm talking to you today from the Vaccine Education Center at the Children's Hospital of Philadelphia. I think probably one of the most common concerns parents have about vaccines is, do they cause autism? Certainly very easy to find that contention on the internet and in chat rooms, so it can be scary. And I think from the parent standpoint, they argue this: look, my child was fine, they got a vaccine, now they've developed signs and symptoms of autism. Could the vaccine have done it? Well, the good news is that's an answerable question. And it's really been in three different areas that this issue has been raised. One is the concern that the combination of measles, mumps, rubella, or MMR vaccine caused autism. The second is the notion that there was an ethyl mercury containing preservative that was in a number of vaccines. Now it's only in some multi-dose vials of influenza vaccine called thimerosal. And then the third sort of concern is that children are just getting too many vaccines too soon, that that's somehow weakening or overwhelming or perturbing their immune system. Well, these are studyable questions. You can answer this question. So, for example, in the case of measles, mumps, and rubella, there now have been 18 studies done in 7 different countries on 3 different continents involving hundreds of thousands of children who either did or didn't get the MMR vaccine, making sure that those two groups are otherwise similar with regard to their healthcare seeking behavior, their socioeconomic background, their medical background. And again and again and again, those studies all found the same thing, that the MMR vaccine did not cause autism, and that's been true also for these other two concerns. The good news is I think most parents get this. I think most parents believe these studies because a recent study by the Autism Science Foundation found that about 85% of parents of children with autism now are comfortable that vaccines weren't the cause. Thank you.
Sorry, anything else on that, Wendy?
I was just going to say real quick that a lot of times people, the timing, it's all about timing. So signs of autism are typically picked up around the same time at the same well-child visits that babies are getting certain vaccines. So it's just important to kind of think about that correlation. Just because it's happening at the same time doesn't mean that one causes the other. Okay, so this is one that Kai alluded to earlier. A family you're working with just attended a chickenpox party so that their kids have a chance to get the disease and boost their immune system. They want to know if chickenpox and measles parties are a good idea. So we have some resources on the next slide. Of course, anytime that a baby or a child gets a disease, there's consequences. And we talked about earlier about natural infection versus immunization and getting the disease, and how when you do get natural infection, your body, your immune system is compromised. You're sick for a long time. This is something that most kids will recover from it. Some don't, and some have lifelong ailments because of it. And just thinking about, in my own situation, I never want my babies to suffer for anything. If there's something I can do to prevent them from being uncomfortable and sick, and I'm going to do all that I can to make sure that happens. I think.
I'm going to skip this one.
Yeah, we'll skip this one, but please feel free to go through and see all these. We've heard Dr. Offit a lot today, and he has so much information on all of these that we're talking about. So please spend some time looking at those. The next one is about school requirements. So mom received a notice from her preschool that her baby is behind on the required school doses. You notice that the baby needs pneumococcal, but mom declines that vaccine because she wants to get the most important ones that are required and will wait on the recommended optional vaccines. So the school requirements are different. They're different by state, actually, and they're different than the national recommendations. And one of the reasons why is because it's easier to change national recommendations. The immunizations that are required for school or childcare now are something that have to go through our legislature, which, if any of you are familiar with that process, is a very hard process. Arizona is a tough state as well. So it's harder to keep up with the recommendations. It's harder to keep up with the science and the times and what is nationally recommended. Just because it's not on the school required list, it doesn't mean that it's not important. And of course, you want to work with your provider, tell your families to work with their providers to make sure that their children are getting the most, what is appropriate for their age and their situation. Yeah, I think that's it. There are two, I'm not sure if you, we can kind of quickly go over it. There's two exemptions, two different ones. A personal belief exemption is for school, and then a religious exemption is for childcare. Of course, these are not exemptions that we want to give out freely. The more of these exemptions, the lower the immunization rate, the lot higher chances that a disease can spread within that school or childcare and in that community. So Kai had talked about earlier that 98% threshold. We want to get as close to that as possible. But in those, the reason that they're named something different is just how it's written in the law. It's just how the legislature decided to draft those bills. You can go forward. And then again, there's more resources if you have questions about that. Finding reliable resources. So I think this is going to be really helpful for you all because, of course, we're trying to give you as much information as we can in this limited amount of time. But this is how you can go and find information on your own. When you hear a question that you're like, well, I'm just not sure about that. It's interesting because once you search something, your online universe is aware of what you're searching. So it says, oh, you like that. You're wondering about this. Let me show you more things about that. So you kind of go down a rabbit hole. So if you search, should I vaccinate, or are vaccines harmful? And that can be a very just genuinely you're looking for information about, but the internet will give you information that you want to see whether it's reliable or not. So it will perpetuate those kind of questions and can really, if you're looking for something, you can find it. So it doesn't necessarily mean that it's reliable and that it's truthful. People, you can't lie if it's on the internet, right? It was on the internet, so it's the truth. And we know that is absolutely not true. Again, if you're looking for something on the internet, you can find it. So we have a list of resources that are available. A lot of videos from the Children's Hospital today, Vaccine Education Center, and that's where Dr. Offit is from. Of course, the CDC. TAPI is huge. They've got lots of information, and if they don't have it, they can help you find it. And then they have a whole bunch of resources that you can use with your families in your professional lives, in your personal lives. If you have family members or friends that are questioning, you can use these with them as well. What's great about TAPI is that they can help you if you want to put your logo on it, so that people, because of course you're a trusted member, you're a trusted professional with those that you work with. If you want to put your logo on it, you can. If there's something that you don't see, and you're like, I really think it would be helpful to have, one flyer just about pregnancy and everything that's all the vaccines that are needed for pregnancy. I believe TAPI does have that, but if they didn't and you wanted that, they would definitely work with you on creating that, and just to make sure that you have the tools that you need.
And that's an extremely valuable resource. So do reach out and utilize that resource, because it's hard to come across material that is professional and accurate.
Mm-hmm. And just looks good too.
Yeah.
So again, we just hope that this presentation really helped increase your confidence in talking to families about vaccines, and at least will lead you in the right direction to look for more information if you need that. We're hoping that, you know, you've got some of your most pressing questions answered, and that you have those tools to reach back. You can put it in your toolbox if you don't need it in next month or so, which I feel like there's going to be lots of questions from families, especially with COVID vaccine, that this is probably going to be popular information, but keep it around and know that if you ever need anything, Tappy's there to help you find the information that you need to work with your families.
Thank you for coming.
And yes, and thank you.
Jasmine, we'll turn it over to you.
Great. Thank you both, Wendy and Kai, for presenting all that information. You guys did such a wonderful job. I think it was really informative. It seems like a lot of people were happy to hear your guys' feedback and all of the examples that you guys gave on the personal level. I think that was really relatable. So here at Tappy, we like to give away free prizes. So if you follow this link that I'm going to be dropping in the chat box, this is going to be an evaluation link. So please feel free to fill this out. This is just feedback on the presentation. And so we can, you know, work to improve any of this in the future for any of our future trainings. So we give free prizes. So once you fill out this evaluation, you'll be able to be in a drawing for a free prize, and we'll send those out within the next week or so. And then also, I know a lot of people had questions about getting certifications for this training. So there is a general participation certificate that will be sent out via email. And also we offer certified health education specialists, registered nurse, and social workers, CEUs, for the training today. And those are for those who were present for at least 95% of the training. So I will drop in that link as well to fill out if you want any CEUs, or if you would like to get a participation certificate. So I'll drop this link in here as well. And I will also send out these links in a follow-up email as well, just in case if you need them in the future as well. All right. So I don't think that there's any other further questions. Again, the presentation, the resources, the chat box question and answers are all going to be available on the website at that link that I shared with you, the whyimmunize.org/10 things parents need to know about why we immunize. We have a lot of resources about COVID-19 on our website. We have those free resources that we talked about. So again, I'll send out all these links via email after the training, so you guys can have those in your email boxes as well. All right, well, thank you all for joining us today, and have a great day.